So today we are going to be talking about COVID-19 and a risk assessment and identifying risk and liability exposure for sports organizations. Everybody right now is anxious to get back on the field, and we have two distinguished guests in order to help us accomplish that. So here are the panelists. First off, introduce myself. I'm Andy Hayes. I was the founder of Next Sports. In my former life, I was a high school biology teacher, lacrosse coach, and I'm currently one of the co-founders and the CEO of Go for Ellis, which is a digital platform that connects athletic trainers with event operators, and oddly enough, in this COVID world, industrial settings, factories, hospitals, all of the above. I'm joined by Ellis Mayer. She's the Chief Medical Officer at Go for Ellis and the current chair of the National Athletic Trainers Association Youth Sports Work Group. She's trainer at Boston University, Penn State University, and Monsignor Bonner High School. And then we were also lucky enough to be joined by John Sadler. John Sadler is the president of Sadler Sports and Recreation Insurance in Columbia, South Carolina. They are one of the leading national insurance agencies in the sports and recreation niche, and their website is sadlersports.com. John graduated in 1983 from University of South Carolina with a major in insurance and finance, and from the University of South Carolina of Law in 1986. He joined his father in the family insurance agency and became president in 1989. They currently insure over 30 national youth sports organizations and have over 15,000 local clients. So welcome to Ellis and welcome to John. I thank you guys for joining, and we will get started right away. So our objectives for today are the following. We want to identify key issues that sports organizations need to consider before a camp, clinic, tournament, practice, or contest can take place. We want to review key questions around insurance and liability for organizations. And finally, we want to examine how athletic trainers can help execute mitigation strategies. Before we kind of dive into the granular parts of that, we want to make it very clear that when in doubt, you need to follow the lead of authority sources. And for example, you got to monitor government health agencies, the U.S. Center for Disease Control and Prevention, obviously the CDC, your state's public health department, and other county and local authorities. And for everybody who's attending the webinar, the CDC recently published guidelines for return to play for youth sports on May 19th. It's a document, it's a very long document. We attempt to distill some of the really important things out of it here today. And lastly, you need to monitor the websites, emails, and social media from sports governing and sanctioning bodies that oversee your sport. And we're going to hone in on why that is so important. John, do you want to add anything to this?
Yes, I would like to say that a lot of people obsess over following all the guidelines from the CDC, but what I would say is that whatever your state says should trump your policy or guidelines. Your state guidelines are probably more important than complying with everything that the CDC has, because the CDC is just so comprehensive. So I think you should concentrate on your state.
Great. Ellis, anything to add?
Yeah, I agree with John. This is COVID-19, and as we know, the infection rates everywhere are completely different. It's different community by community. You can drive 20 miles away and they have a completely different rate of the disease there. So I agree with John that following your state and local guidelines, your county public health guidelines, is very important. The CDC does give guidelines, but it's really the state and local people that are really going to be the ones that are the biggest stakeholders here, and that they're the ones that are going to be enforcing the local rules.
Great, thank you. So I'm going to introduce Ellis again. She is going to talk about performing your own risk assessment as a sports organization. And just so we're very clear, the three of us are working hard today to help all youth sports operators and organizations get back on the field. We need to get back on the field. We need to restart sports, and Ellis is going to talk about some tactical things that you can do as a sports organization to understand your risk and to help mitigate. So we created this risk identification checklist that we will also make available to everybody after the webinar. And I'll let Ellis kind of go through each one step by step.
Great, thank you, Andy. So the first item on our risk identification checklist is sport. So the risk of contracting COVID-19 changes greatly with what sport people are playing. So there's some sports that innately have more distance between people. So baseball, for instance, has much more distance than, say, wrestling. Some of our high, more contact sports it might be a little bit harder to enforce those social distancing guidelines due to body checks and other things like that. There's sports like basketball or volleyball. They also require a lot of contact within equipment and transferring the equipment from one athlete to another. Youth sports, as we are seeing, is the first kind of realm of sports that's really coming back. One of the reasons that we're seeing this happen is because the ability for us as youth sport event operators to change the rules. So if you can mitigate some of this risk by potentially changing some of the rules on the spot to make these risks a little bit lower. So for instance, if you're running a cross-country meet, instead of having that massive large pod of people go all at the same time, maybe we're doing time starts. Or if you're in soccer, maybe we go back to kick-ins like you did as a younger kid. So there's ways that you can change the rules within your sport to help mitigate that risk.
Great.
Another item you want to keep track on is age group. So in theory, our older athletes should be able to follow social distancing guidelines a little bit better. They should be able to understand that they should bring their own water bottle, that there won't be water provided, that they don't want to be sharing water, that they understand that you should stay away on the sidelines, and that they truly understand the distance that 6 feet is, where our younger athletes might not be able to quite understand that distance. One of the strategies here is if you are running a camp or a clinic or a session with younger groups, you could ask those parents to potentially stay there, have them socially distance on the sidelines. So during those breaks, have their child run back to their parent or guardian and have them sit with them to try and help organize and keep the social distancing guidelines true as these sessions go on. So event type is going to be a very large one with identifying risks. So there's a very big difference, as we know, between going from a tournament that involves people from all over the country versus a small group training or even a camp or a team practice. You want to really take a look at your event type and address all the needs of the stakeholders. So this is where you really want to come up with your plan ahead of time, and you want to give that plan to everybody who's involved. So you're going to send this out to the club directors if you're running a tournament. We're going to send it out to the referees. You want to make sure the athletic trainers read it and review it. And you really want to get that feedback and make sure everybody's on board and they say, hey, this looks like this is really well organized, well thought about. Or they can be a part of that process of developing that plan and say, hey, maybe did you think about this? So really identifying and kind of coming up with the risks specific to what your event is very important, and addressing all the needs and including the stakeholders in those conversations.
Yeah, and if I can just jump in here and add like one thing in particular, I can't stress enough in my former life of running events, like making a list of all the stakeholders that may or may not attend and are a part of these events is really, really important. And for example, referees who tend to be in the high risk sort of cohort for COVID-19 infection, they might not come and work a tournament, and they might not come and support a sort of contest. So I can't stress this enough. As a former event operator, making a stakeholder list and what the expectations are is very, very important. And if I can just say one more thing, this is the first webinar in a series. And as I said, we are interested in getting people back on the field. So in the coming weeks, we will have specific event types on how we would potentially make these happen. So very important.
To add there, Andy, is that if you're a club director and you're thinking about going to tournaments, that's something that you might want to think about too, is what type of event are we going to bring our teams to? Are we going to start with practices that are small-sided? I mean, most of us have been in quarantine for several months now. So jumping right back out and sprinting down the field right away might lead to definitely going to have a higher rate of musculoskeletal injuries. So really making sure we progress our athletes back and getting them ready to get into these certain playing situations to kind of reduce, obviously, COVID-19 risk is something we want to think about, but also musculoskeletal injuries as well.
Great.
So expected attendance. This is something that is an easy kind of thing to address. Let's think about, there's certain ways you can calculate crowds and how many people are going to be there. Do you limit some fans? Making sure you're counting everybody. Like we said, referees and athletic trainers are going to be there, so they need to be in your mind as an attendance number. Ways to kind of reduce that is reduce those numbers for expected attendance. Potentially, if you're running a tournament, maybe there's no vendor village, or you limit concessions. Everybody has to bring their own food as opposed to purchasing food at a tailgate. T-shirt sales, things like that. We want to really try and limit the extra people that are going to be there to try and limit the amount of people that are there and potential transfer of COVID-19. Location is another big one. Is your venue indoor or outdoors? There's going to be probably a lower rate of transmission if we're outside in a big open field and there's lots of space around us. If you're packed into a small gymnasium, there might be a higher risk of transmitting COVID-19. Is there enough space in between games for staff to take breaks or for teams or players to go somewhere else? Another thing you could think about too is there a single point of entry? So a lot of our large sporting venues are designed for crowd dynamics and crowd control. So if you think about entering through a single point, this is where you have large groups that then filter through cattle chutes through one entrance and then go into where they need to be. So that they're already designed to handle crowd control in a different way. So this is something you might want to identify is how are people getting in the door and how can we enforce social distancing? If there is a single point of entry, you might want to have to maybe mark out X's where are 6 feet away from each other on the ground. So if there does form a line, you have some verbal cueing for people to maintain their distance, and then also have some extra staff out there trying to help them get organized and get into your venue in an organized fashion.
And Ellis, is location also, this goes back to what you and John were talking about as it relates to state and local guidelines. Location, geography also plays a part in this when we talk about location, not just specifically what kind of venue it is. Is that correct?
Yep, and we'll get to that on the next slide.
Great, there you go.
So local and state, there's a big difference between a local event, a small practice in your local community that had very low rates and we're in the green phase or whatever phase your county is calling it, versus a large interstate event. Things to keep in mind is the CDC does want to try and limit travel in between areas, specifically having people from high rates of COVID-19 areas coming to lower rates of COVID-19 areas and then infecting everybody there where a county is already doing pretty well. So that's something to keep in mind is if it's an interstate event, what are also the specific rules of the state or the county? If you have a tournament in another state and the state is wide open, that's great. However, you need to remember where your people are traveling from, your own event staff. So if you have to come back to your home state or county, is there a mandatory quarantine period? Is there things like that you need to think about as far as interstate travel goes, is being mindful of those quarantine periods if they're still in effect. I mean, we're up in the Northeast, so we're still very much in kind of a quarantine thing, where elsewhere in the country, we're seeing things are very open. So this is something to keep in mind as some of us are part of national companies. It's going to be a very different situation everywhere you go, and just keeping in mind where you're traveling and where your staff is traveling. So contact audit. This is kind of a good exercise to bring you and your team together to really think about and be mindful of what are people touching. So I mentioned earlier with the soccer balls. So if we're doing throw-ins versus kick-ins, how can we limit or reduce the amount of time that people are touching surfaces? You want to think about handles of bathrooms in the stands, maybe even handing back waivers. Maybe we should not do paper waivers on site. We want to do all that stuff online before people even get there. The CDC actually does have a good, if you are going to go the disinfectant route and be monitoring and disinfecting things as you go throughout your event, they do have a good list of approved disinfectants that you can look into and see what type of disinfectant should I purchase prior to my event.
Great. So, that's sort of that 7-point checklist is something that we believe any event operator who's going to put on a camp, event, whatever it may be, needs to think about before they do so. So Ellis, thank you very much. That was fantastic. We're going to shift gears to the more insurance and liability factors with John, who has been doing this for a very long time and has a great blog, which we will also make sure we get out to people. He has the single most comprehensive sort of aggregator of information regarding reopening insurance, liability, and legal factors that would be very useful to people who are joining our webinar. So first off, John, let's talk about the potential liability exposure for sports organizations.
Thanks, Andy. Well, I think probably everybody's aware that the two biggest legal concerns are, number one, negligent failure to cancel an event resulting in a COVID transmission, and number two, negligent failure to take mitigation steps if the event is not canceled and if the lack of mitigation results in a COVID transmission event. So that's what we're talking about as we go through the slides today.
So with that in mind, how do we talk about negligence?
Yeah, so the lawsuits for a COVID transmission incident are going to be based primarily on negligence. So in order to prevail in a case of negligence, the claimant has to prove 4 elements. It's not enough to prove 3, you have to prove all 4 of these elements. The first is that a duty is owed to the claimant. The second, a breach of duty by not following the mandatory regulations and or guidelines by the various authority sources, CDC, state health departments, local, and the sports governing bodies. Number 3, breach of duty must be the proximate cause of the sickness. And of course, number 4, damages must result. So let's take a look at each one of these elements in a little bit more detail. First of all, the duty owed to the claimant. I think you probably owe a higher duty to participants, such as your staff members and your players, as opposed to spectators. Number 2, the breach of duty. This is what we're talking here about, these mandatory regulations and guidelines. These are mitigation techniques that you need to employ. And in a lawsuit, you're going to want to defend yourself by proving that you did adopt and implement the mitigation techniques. So documentation is going to be critical here to defend yourself on element number 2. Element number 3, the breach of duty must be the proximate cause of the sickness. Now, this is where the authority sources out there from the insurance industry and attorneys and law professors, they say it's going to be very, very difficult for a claimant to prove proximate cause in a negligence lawsuit, because in order to prove this, you're going to have to prove that, number 1, the claimant was not sick already when attending the event. Number 2, that on the way to the event, that there was no contact with anybody or no shared spaces. Number 3, after the event, they've had no contact or no shared spaces with anyone. And oh, by the way, there's a 2-week period of transmission. So how are you going to prove all this over a 2-week period, the incubation period? It's going to be extremely difficult to prove here. Now, there are some fears out there of a cluster event where a number of participants or spectators come down with COVID at once. And I think there have been 3 such cases highlighted in the United States and a major case in South Korea. But I think it's going to be very, very difficult to trace these outbreaks back to a single event. And I know there's a lot of talk out there about smartphone apps, Google, iPhone, but honestly, you're going to have such a low percentage of people that are going to actually voluntarily participate in that. And a lot of people have privacy concerns over that. So I really don't see that going anywhere.
Great. So one of the things that we get is like, what's the legal risk here compared with some of the other things that youth sports operators are need to deal with?
Right. So I like to draw analogies between COVID and the two heavyweight worst case scenario fears that we've typically spoken about in our industry, which are child abuse, molestation, and brain injury, concussion lawsuits. So as risk managers, when we analyze a risk, we look at it in terms of both frequency and severity. A frequency risk, that's the risk of getting a lot of small lawsuits filed in a certain period of time. So what do we know right now about the frequency risk of COVID? We know that as of right now, it's very low. I've interviewed the head claims managers from two of the leading sports insurance providers in the country, and as of last week, there are no known lawsuits that have been turned in. Now, that's not to say that things can't change, but also I'll mention that due to everything that COVID is doing, it's my understanding that the court dockets are going to be tied up for 2 years. And you could argue that attorneys really don't want to spend money to bring one of these low probability lawsuits and have to wait 2 years to recoup their expenses. So on the severity risk, that's a risk of a large dollar payout in a lawsuit. And what I'll say is that the risk of a large dollar payout for COVID, you might think is high because there's a possibility that a single person or multiple people could die due to the exposure. But it's just so darn hard to prove negligence, as we've already stated, because it's very, very low probability to prove approximate cause. But on the other hand, you compare that to child abuse and a second injury impact situation with brain injury, it's very easy to prove negligence in those cases. Also, what I'll say is that there's a much stronger case for an assumption of risk defense with COVID. After all, the media has been telling us 10 times a day for 2 months plus that we might die, that life will never be the same. And so we have that. We also have the waiver release agreements, which are strongly recommended. We have the signage. And so it's just a much stronger case for assumption of risk defense with COVID. And then there's the anger punishment factor. Just think about the angry claimants. If their child has been sexually abused, or they've sustained a second impact injury to their head, they're going to be very angry. And part of that lawsuit is going to be the punishment factor. And I just don't think you're going to see that with COVID. And getting back to the mass media, I think my clients are unreasonably scared of the liability risk from being sued over COVID. And I don't blame them. With, life's never going to be the same and you may die, but just think about it for a minute. Think about how scared that our parents and administrators would be if every day on TV or on social media, they saw a chart and the chart kept a scoreboard of how many children were sexually abused that day or how many suffered concussions. If you saw that 5 times a day for 2 months, you'd probably be scared out of your wits too. So I think the media has a lot to do with this perception of the COVID liability risk.
And so here's the big question, John. I know everyone who's in youth sports, does their GL or their general liability policy provide coverage for a COVID-19 transmission?
Well, that's a good question. I think it's never been the intent of the insurance industry or the carriers that they would be paying claims arising out of a pandemic. But with the way the policy is written as a contract. And I think that carriers will, in some situations, will be forced to pay the claims. But that depends on a number of factors. As an insurance agent, I can never tell a client for sure that any claim is going to be covered for that matter, regardless if you think it's a slam dunk or not, because it depends on the exact causes of action that are alleged in the lawsuit papers. It depends on the facts in a particular case, the existence of certain exclusions in a policy, and how the various courts and jurisdictions interpret those provisions in the insurance policies. You'll find typically that you have both, for any provision out there, you have thousands of pages of case law, and you have a majority view that's taken by most state courts, and you have a minority view that's taken by a smaller percentage of state courts. So it really depends.
Great.
So what I'll say is that if your general liability policy does not have a specific exclusion for communicable disease, virus, or pandemic, you have a much, much greater chance of getting coverage for a COVID transmission lawsuit, which includes the all-critical legal defense. Now, I've interviewed two of the head claims managers for leading providers of sports insurance in this country, and both had the same opinion on this matter. I asked them, I said, if you're presented with a COVID transmission lawsuit, and if the policy does not have the communicable disease exclusion or similar, what's your response going to be? And they said, well, you know, the normal disclaimer, it depends on the facts of each case, but their gut feeling was that generally the carrier is going to provide a legal defense under a reservation of rights letter. So reservation of rights letter, that's what you see every time you turn in a claim to an insurance carrier for a liability lawsuit. It says we'll provide you with a legal defense up until the point if we find out that, you know, based on the facts of this case, that there may not be coverage, then we reserve our right to drop your legal defense and coverage. But I can tell you that once they accept legal defense, it's very rare that they will drop the coverage after the fact. And I think that most claims adjusters are actually conservative when coverage falls within a gray area, because they're scared of a lawsuit for bad faith refusal to settle a lawsuit. A claimant can file a lawsuit, and it can be multiplied damages and punitive damages if the insurance carrier is deemed to have acted unreasonably. So that's an overview. I have a more detailed answer in my blog that gets into some more specifics, but I think you need to know that. And I can tell you also going forward that most of the major players in the sports insurance industry are planning on having a communicable disease exclusion in the near future if they have not already added that to the policies.
Great. So can we talk a little bit, so this is, I know this is one that we get a lot, about COVID-19 waivers, risk warning and assumption of risk. And, you know, what would you be counseling your clients on as it relates to COVID-19 waivers?
I'd like to say, first of all, the waiver release agreements are worth the paper they're written on, despite what you might have been told by your local legal counsel. We have an excellent blog under the risk management section of our website that explains this. It will explain how they work better for immediate lawsuit dismissal for adults versus minors, but it's even if the lawsuit's not immediately dismissed, that it can trigger an assumption of risk defense if even if it's, you know, you don't get the immediate dismissal for a minor, because you can introduce it into evidence as a risk warning being provided to the minor. But anyway, traditionally the waiver release agreement's only keyed in on injury, but what we're having to do is everybody needs to go back to their regular minor and adult waiver release, and they need to add specific language in, not only for injury, but also for illness and sickness. And they need to talk about communicable diseases such as COVID-19 and MRSA, for example. Also, traditionally, when you think of waivers, you think of having only the players sign the waivers. But in the situation with COVID, you really want your adult staff members to sign a waiver release also, because in most respects, they're the ones that are most vulnerable to COVID transmission and serious complications or death in a lawsuit. So you want to make sure you get that taken care of. So on our website for our regular, minor, and adult waiver releases, we've added the language in there. And also we have a special communicable disease, including COVID-19 waiver release that we've designed just for that one application. And it's all available from links in our blog and on our website.
So John, just so I understand, because I think that's really important. So if I'm running a tournament and I have 50 staff members who are helping me put on that tournament in the COVID-19 world we now all live in, the suggestion is that not only do you need COVID-19 waivers or language for participants, but also for the staff and the other people and employees that would be working at that event.
That's correct. They're probably much more vulnerable than the players.
Yep, great. That's a great piece of information. So what about signage and the assumption of risk? I think that's a big topic that I think would be helpful for you to elaborate on as it relates to warning people about what's going on.
Right. So the waiver release does a great job of providing a risk warning and setting up an assumption of risk defense for your actual participants, that being the players and the staff. However, we also have to worry about COVID transmission with spectators, and of course, spectators are not going to sign a waiver release agreement, and so that's where the risk warning signage comes into play. It's very important, in my opinion, to post warning signage at key points throughout the facility. Even if the facility doesn't do it, if you're a sports organization using the facility, I think you should have your own signage in the event that the facility does not have adequate signage.
Got it. So this is obviously, you want to talk a little bit about this sample language. Obviously, I'm going to go right to the bottom. You need to have your local legal counsel reviewing all of this, but do you want to talk a little bit about your sample language, which also is on your blog?
Sure. You want to make sure the risk warning has strong language. Don't be scared that you're going to scare away your spectators or your parents. I think everybody understands. But I'd say of all the elements on this list, one of the key elements is that seniors or others with compromised immune systems should be warned that they might not want to participate in or attend the event due to the risk of infection. So that's pretty strong warning there, which I think would really pay off if there's a COVID transmission lawsuit. And then, the rest are just your standard social distancing and personal hygiene practices that should be employed. But I think it is powerful to have the signage.
Great, that's a great point. So you want to talk a little bit about additional defenses if it gets to that point to protect your organization? I think getting into the granular parts of this would be very helpful for people.
Right, so I just want the audience to know that there are all kinds of defenses out there for a COVID transmission lawsuit. We've already talked about how difficult it's going to be for the claimant to prove the proximate cause element of negligence. But in addition to that, just in case they can't prove it, or in case they can prove that, there are a number of defenses. We've talked about assumption of risk and how you can make that stronger with waiver release and signage. And you also need to send out an email to all the stakeholders prior to the season or a tournament or camp event that explains things to them. And then we have comparative and contributory negligence. And that defense takes into account that the participants and the spectators have their own responsibility to practice their own personal discipline to protect themselves. And if they don't do so, that's a defense as well. And also, we have the Volunteer Protection Act, which is an often overlooked defense. Basically, there's a federal legislation, and most of the states have an act too. And to the extent that the federal act provides more protection than the state act, the federal act preempts the state acts. And so basically volunteers of not-for-profit organizations have immunity from lawsuit as long as there was not gross negligence involved. Now, that's certainly protection worth having, but it's not, that can always be disputed, the element of gross negligence, but it's very hard to prove gross negligence. But so that's great protection. Also, we have COVID immunity legislation on the state and federal level. I think about 5 states have already passed some form of COVID immunity, whether it's a statute or whether it's a short-term proclamation for immunity, and it's being debated now on the federal level. Don't know if we're ever going to get there because of the politics of red state versus blue state, but I think we're going to see some protection there. And even though it's not a legal defense, I just wanted to point out, not many commentators are stating that there's a potential that if you are a volunteer for a not-for-profit, that you could have coverage under your homeowner's liability or even your personal umbrella policy for a COVID transmission incident. There's, various authorities say it goes both ways, and most of those policies do have a communicable disease exclusion, but the ones I've read, it only applies if the insured was the source personally of the COVID transmission. But in the situation with the sports organization, that's not what we're going to be looking at. But anyway, a lot of legal defenses here for your protection.
Here, thank you for diving into the insurance and liability. And both John, Ellis, and myself are now going to change our focus here on how hiring an athletic trainer helps sports organizations execute mitigation strategies and support event operators. And before we kind of dive into those specific strategies, I would love Ellis to kind of give a 2 or 3 minute overview of all the things that an athletic trainer already does in their current skill set that can help you as a sports organization execute on an event and the mitigation strategies that would need to happen to go with it.
Great, thanks, Andy. So athletic trainers are allied healthcare professionals. We specialize in the sports arena that we're found elsewhere. We specialize in injury, but we also specialize in illness. So a lot of people think of athletic trainers really as in the musculoskeletal or orthopedic vertical. So we're taking care of ACL sprains and dislocations and things like that. But a lot of what we see that comes in the door is general illnesses. So what do you do when somebody comes up to you not feeling well? So athletic trainers are well equipped and well trained and understand what it is to do an evaluation when somebody's not feeling well. And you want to go to the next slide because we kind of get into it there. Yeah,
absolutely.
So hiring an athletic trainer in this situation, I am an advocate. If you're having sports, you should always have an athletic trainer on site. But I think it's even more important now. So prevention is our number one goal all the time. So whether it is preventing ACL tears, like I said earlier, or preventing COVID transmission, we are always trying to think 1, 2, 3, 4, 5, 6 steps ahead of everybody else, because if we can prevent the injury or illness from happening, then it makes everybody's life easier. It makes our patients better. It makes our coaches' lives easier. It makes the tournament director easier. So prevention is really our key focus with this stuff. So having an athletic trainer, hiring them for a COVID coordinator, helping you develop that plan, helping you go through these risk mitigation strategies, really helping you kind of execute the plan that you develop together, they're an invaluable resource in running a tournament, and especially nowadays as well with this whole COVID situation going on.
Hey, and John, I know you referenced the COVID coordinator in your blog heavily. Can you give a couple seconds or on the COVID coordinator and their role as it fits into liability and insurance and things like that in mitigation?
Sure, there's so many moving parts in a COVID risk management mitigation plan that it makes sense that you want to appoint one person within your sports organization that is responsible and has authority for the adoption and implementation of the program. And so I just think it makes sense to have a single coordinator, just like, for example, a safe sport, child abuse, molestation, risk management plan. They have a single coordinator because there's so many moving parts there. So I think the same is true for COVID, and I think it's an excellent idea if you wanted an athletic trainer to take the lead on a number of those components.
Emergency action plan and pre-event planning is a major part of what we do. Every athletic trainer knows what emergency action plan is, written definitely more than one. So this just is almost a subset of the emergency action plan of what do we do when these things happen, or how do we prevent any of these things from even occurring on site.
And I also can comment as a former business owner at Next Sports that this to me would be paramount to alleviate the concerns of my parents and my participants, that I have somebody who's in charge of these types of things. And so I can't, not only from an athletic trainer side and insurance and liability side, but just as a business operator, this would be my priority. Who is my COVID coordinator? Who is responsible for making sure that we are following all of these strategies and guidelines that are being laid out from lots of different places? So that's huge. Ellis, you want to talk a little bit about your pre-event communication? I know you just kind of talked about it. I know this is like your number one thing in the whole world. So feel free to get going on this.
Yeah, pre-event communication is huge. So setting the expectations and letting people know what the plan is ahead of time. So I said earlier, talking about let's develop a COVID plan. Let's get all the stakeholders in the room and let's talk about how we're going to address the needs of our referees, the needs of our field coordinators, the needs of whoever else is going to be there. And then once you have that plan, you need to communicate that plan out. You need to let your club directors know, hey, these are the rules ahead of time. And let the parents know, hey, there's no tailgates because there's going to be a lot of food swapping. So you're going to have to bring your own water. You're going to have to bring your own food because we close down concessions because it's another point of contact or another point of gathering. So that's pre-event communication about what people can expect when they arrive on site is a huge part of risk management.
John, anything to add on that? I know you talked about signage and waivers and stuff. Is there anything else specific you want to comment on pre-event communication as it relates to insurance and liability?
Well, the CDC and a lot of state mandates and guidelines talk about you have to do that. You have to have the pre-event communication, and a lot of states say that there are certain things you must say in that communication. So it's critical.
One more thing to add to that, Andy, with the pre-event communication, just because it was your plan last year might not mean that it fits this year. So you might want to re-examine all of your policies. And if typically the lightning safe shelter at your school is the dugout or an auxiliary athletic training room on the field, you're going to smash 50 people into a small room because there's lightning. You might need to readdress those policies. If it's a tournament, we used to go into the giant field house. Well, that's not really our safest strategy. We're now going to change that, and we're going to tell people to go to their cars instead. So you need to really take a holistic view of what did we used to do, and then pick it apart of where are the potential risks and how can we protect people at our event.
That's a great point on the lightning. Okay, this is another big one. Everyone's here talking about PPE, personal protective equipment. Ellis, I know that you are very familiar with this. What is PPE? What do we need to know about it?
So PPE, as far as we as healthcare providers, we usually wear our N95 masks, or we'll have our gloves. In more of a clinical setting, you might have a face shield. You might see, if you've been to an emergency room or other healthcare facilities recently, you'll see that there's a lot of barriers between the clinicians and the patient. In these settings, it's probably not going to be as intense for PPE. However, masks are something that you're going to see your athletic trainers wearing, or a lot of people asking about wearing. PPE is another thing that you want to keep on hand to help protect your staff as well. And also potentially, we're going to get into this a little bit, if somebody were to fall ill or have a suspected COVID case, PPE is something you might want to have on site to help handle that scenario, which we'll get into in a little bit, but that's another thing that you might want to have a little bit extra on hand in case something does happen.
Great. John, anything to add on that?
Well, I know that there's been a lot of talk about regular staff members wearing PPE gloves in particular, but I've noticed that the latest CDC considerations for sports organizations, they really makes no mention of gloves for team or event staff other than taking out the trash. So I found that to be interesting, but there's some state mandates and guidelines out there. I believe the state of Texas, for example, may mandate gloves in some situations. So you have to go by what your state says.
And also, if gloves aren't available, then making sure there's hand washing stations and plenty of hand sanitizer around and signage about that for really promoting good hygiene at the event is very important.
Great. So this is the one that everyone's talking about, temperature screening. Ellis, I think you can speak to sort of the venue requirements and how this is going to most likely evolve over the next couple months.
So temperature screening is an interesting one. This is one that we're seeing happen all over the country right now in certain settings. So one of the symptoms of COVID-19 is having a fever. Is it the only symptom? No. So could you have a lot of other symptoms and not have a fever? Yes. So it's not a bulletproof method of really deciding if somebody has potentially COVID-19 or not. There's also different methods of temperature screening. So what we're seeing a lot are the laser gun thermometers that are taking the forehead temperature of people. If we look at the literature, these are not the most accurate measurements of core body temperature. So this is something you might want to think about if you're developing a hard and fast policy on temperature screening. Make sure that you follow that policy. You're going to get yourself into trouble if you say if anybody has a fever over 100.4, we're sending them home. Then if you're using that kind of thermometer and somebody's standing outside in the middle of the summer and you take a forehead temperature, they very well likely might have a temperature that's a lot higher. So as per your recommendations or as per your policy, you technically might be turning away 50 people that day. So make sure that you're really thinking about the implements and the measurements that you're using and the screening that you're doing. A lot of people are recommending that we have people do self-checks at home, have them take their own temperature. If they're not feeling well, which is in the pre-event communication, don't come. If you think you might have been exposed, don't come. So there's some other ways that you can screen your participants and your fans ahead of time, other than just the temperature screening part of this. John, do you have anything to add?
Nothing other than the latest CDC considerations makes no mention of thermometers.
And I think that's because what we're seeing is the inaccuracy of them and the methods that they're being utilized.
Yep. Great. So monitoring. So this is a big one. I'm going to put on my former event operator hat. You know, obviously people who run club teams and events, there's a lot of moving parts here. And in the COVID-19 world, I think there's probably even more. And so monitoring your event, the venue, your participants, your stakeholders, this is super important. And Ellis, can you talk about sort of your former role as the Director of Health and Participant Safety? Because this was your primary focus. How do I monitor the safety and health of all the participants and stakeholders at every next sports event?
Yeah, so monitoring, again, that's a big prevention part of everything. So you, as a medical professional, I get there early and I make sure things are set up appropriately. I'll do a walk through the fields, make sure nothing's sticking out. Potentially, you're gonna, that morning, identify some maybe weaknesses or challenges within your emergency action plan that day. So if the emergency action plan says that the ambulance comes in this specific gate, but it's locked at 9 a.m., you should probably try and figure out who's got the keys and get that gate unlocked. So there's a lot of things that you need to do ahead of time when you want to monitor your situation and really see when you show up early that day. Make sure everything is there, all the supplies that you thought were going to be there and were expected to be there. Make sure everything is, all your ducks are in a row and you have that plan and you can execute it as written out on that piece of paper, because that's how you already trained your staff. Everybody, you already circulated the plan for when an injury happens or when a COVID-19 incident happens. So you want to make sure that the plan is able to be executed the day of.
So one thing, before I go to John, because I know we were talking about this yesterday and this morning, and you have some examples in Alabama and other places in terms of monitoring and, what happens if someone shows up at an event and refuses to wear a mask. And so that's obviously part of this monitoring, and the state and local guidelines require that. So, John, I think it's important for people to hear your perspective on, okay, someone shows up and refuses to put on a mask or refuses to follow the guidelines that you are trying to meet.
Yeah, that's a tough one. If you have guidelines that you publish, you want to make, or for example, if the state has mandates or guidelines, you want to make best efforts to follow them. But it's if you don't follow 100% of them, there is some risk there for sure. But then again, you just need to make best efforts to enforce it as much as you can. So there's probably not that great of legal risk if you don't have 100% enforcement. So for example, if a spectator shows up and refuses to wear a face covering, and if the state guidelines call for it, you speak to them once or twice, but then if there's no compliance, just document it and move on. There's always a threat of legal risk for turning someone away. So you just do the best you can with your enforcement, but you can't always get 100% enforcement.
Right.
Would you also say that's something you should be careful about when developing policies? If you have a policy that says everybody has to wear a mask, and then you have that situation arise, are you at more risk then?
Yes, I think you're at more legal risk if you have policies and procedures that you don't enforce. So I think you need to take that into account. Instead of maybe using shall, maybe you should use should. Should is strongly recommend. Shall is mandatory.
Great. Alice, this is one. This is what we've been talking on since the beginning. Can you elaborate on the state and local compliance and documentation?
Yep, absolutely. So as we know, there's the CDC recommendations, and then it's layered down from there. And it's coming down from our CDC, and now our NGBs are starting to make recommendations for us on how we should be running events. And then the CDC then kicks it even further down the line to the state. And sometimes the state in certain situations are saying, you need to get this cleared with the county. So this is a process that you should start way ahead of when you're thinking about having an event, because it might be hard to get a hold of some of these state and local officials. And this is something you want to have that whole plan together, and you want to go to these officials and say, hey, this is our plan, and this is how we want to execute. This is how we're going to handle all of these situations. We're good to go as far as the legality goes, and we want to make sure we get an okay from you, or are we missing anything here? So this is something that you can really get an okay from the state and local officials. If there's extra documentation that they require, if the venue maybe might require something different of you. So this is something, again, it's the stakeholders, not necessarily internally, like our coaches and our patients and our athletes and parents. We have got some external stakeholders too, like the county public health officials and the state public health officials. So this is something you want to make sure that as you develop these plans that you are checking and double checking. And it's tough because a lot of these recommendations are changing by the hour, by the moment. Everybody's opening up at different rates in different areas of the country. So it's something you really want to keep on top of if you are identifying the locations of where you're going to be running events. Contacting those local officials and checking their websites to get the most up-to-date guidance on compliance and documentation.
Great. John, anything to add to that? If you have the resources, you could make a simple checklist of to check off at every event that you've done what you said you were going to do in your mitigation program, and you could sign it and date it. That would certainly be helpful in the unlikely event of a COVID transmission lawsuit.
Yep. Okay, so this is a big one. Alice, you want to talk about this? Is probably one of the primary reasons that having a medical professional on your team at your practice camp clinic, tournament is so important.
Yeah, absolutely. So participant evaluation and response. So if somebody is exhibiting symptoms, what do you do? This is something that the athletic trainers, like I said earlier, we are well versed in injury, but illness is a major part of what we do. Taking vital signs is a major part of what we do. Taking patient histories. So athletic trainers are very familiar with the signs and symptoms of COVID-19 and being able to do an evaluation and just figuring out what bucket we're in. Do we think that maybe they're just not feeling well today, but we don't think it's necessarily COVID, or maybe it is. And as we're going through our evaluation, we're thinking we should probably get a mask for this person. We should probably handle the situation a little better, which I think we're going to get into in a little bit here. But athletic trainers, we are very well equipped and able to do these types of evaluations. And then another thing that you have to think about is if you do have a positive case, how are you going to then communicate that to the county health officials and other things like that, which I know we're about to get into, so I don't want to steal the thunder of the next couple slides.
Yeah, I think just to based on time, we can start thinking about this, and I always like to put Ellis in these situations, and now John also, where here's a tactical case study on what would happen. And so as an event operator, I'm running a camp, a clinic, a practice, and the registration area is obviously sort of a nebulous concept for any place where people arrive. And all of a sudden, a parent stumbles into the registration area exhibiting COVID-19 symptoms. What do you do? And I think this is sort of the culmination of this whole presentation. And I'm going to put Ellis and John on the spot here, both as an athletic trainer who may be the person on staff there to handle, and then obviously from an insurance and liability standpoint, okay, the odds are that this is going to happen somewhere in youth sports in the next 6 to 8 months. So Ellis, as the COVID coordinator, head athletic trainer, chief medical officer at Go for Ellis, what do you do in this situation?
So this is something, if you're going to want to treat the patient that's in front of you. So it's going to be a completely different evaluation depending on who this person is. So if it's a parent or a grandparent versus a child, so you want to make sure you're looking at the patient in front of you and doing the correct evaluation. You want to do a very in-depth one. If COVID is in your first thoughts of potentially this could be exhibiting COVID symptoms, you're going to want to isolate that person right away. You want to get them away from the other groups. But you also need to be mindful of HIPAA. If you have a giant circus tent that says this is the COVID tent, you're now putting people in a situation where you're telling people the potential diagnosis of this person. So you want to make sure you have kind of a private area where you can pull them aside and say, hey, I'd like to come bring you over here to an evaluation. So you can separate them away from other clinicians. You also want to make sure that we're trying to mitigate the transfer of the virus if possible. So handing them a mask right away. Being able to communicate what the next steps are. So say you do your whole evaluation and you're thinking, you know what, I really think you might have a COVID-19 infection. What are you going to do with that? So if it's a parent and they have a child there, are we going to keep the parent with the child, or is there another parent on the team that can take that child home? If they're unable to transport themselves, should we be calling an ambulance for them? Another big thing that if you do have to call an ambulance, you need to let them know when you call 911, hey, this is a potential COVID patient. So the ambulance staff that arrives on site is prepared to prepare themselves to transport that patient to the appropriate facility and with the appropriate PPE and what they need to be ready to transfer that person.
Great. John.
Right. Well, I guess if a person is exhibiting symptoms and you tell them that they must leave, taking into account all the considerations that Ellis brought up, I guess there's some fear that the person may not want to leave, and if you make them leave, there's a possibility of wrongful access lawsuit or something of that nature. But clearly, the CDC and I think virtually every state says that you should turn someone away if they're exhibiting symptoms. So the law is on your side if you do so. But what you want to do is you want to make sure you document it. You want to make sure that you have an incident report form and you have witness statements such as the person said they were not feeling well, or they were coughing and sneezing repeatedly. So documentation would be important in a situation like that. And I guess you can always call law enforcement if they don't cooperate. But
And another thing you
hopefully not.
communicate that potential from a healthcare standpoint. You want to be able to contact tracing and things like that are very important at the moment. So if this does come back as a positive COVID-19 test, helping, you obviously don't tell them that Andy Hayes has COVID-19 because that's a HIPAA violation, but saying, hey, there was a potential exposure here. We had a case and asking the county health officials and the state health officials how to handle that situation.
Great. So we have, I am going to quickly we have 12 questions from people, which is great. And I am going to attempt to ask those of everybody, Ellis and John, and I'm just going to go right down them so we can get these answers. So the first one is, should parking where people drop off and pick up also be factored in, pre-messaging out to all attendees with maps and information? Ellis, I'm sure in your previous life, you were a big part of that. You want to tackle that one?
Yeah, parking is always one of the biggest challenges, regardless of the size of the event. Parking is something that you should always be looking to organize and looking to mitigate any sort of incidents, whether it's an accident in the parking lot or something else. So parking is a major thing, and pick up and drop off is a big one. If you can do some sort of car line where the parent just drops somebody off and then come back later, so the parent doesn't even have to get out of the car, that's fabulous. And it's even spaced out because of that. And the certain kids might get dropped off with certain coaches because it's a camp. So maybe if you're all going to the same camp, we have the red team, and the red team gets dropped off with the red coach. So you're staying in those small cohorts to limit that exposure. So maybe there's a red car line where the kids are only dropped off with that certain coach and a certain team, so they can go to their certain field and really not have to overlap and have this massive disorganization in the parking lot.
Great. John, this one's for you. If I bring a club sports team to a tournament, what is my potential liability, or does the liability fall on the event operator exclusively?
No, the liability potentially will fall on the travel team as well as the event operator. They both need to follow mitigation practices.
Great. This one will be, I think, Ellis, this one's for you. Actually, it's probably for both of you. Should an operator provide PPE to staff working? If they don't provide it, should they mandate that staff wear PPE?
John, you want to handle that first? Well, the mitigation plans I've seen suggested by CDC and state authorities, it says that either the facility owner or the sports organization, certainly they're responsible for hand sanitizer, washing stations, and of that nature. But if face masks are provided or required, I would think that's up to the individuals to bring their own. As far as gloves go, if the staff is required by the state to have gloves, I guess the sports organization or the facility owner should provide that. But I think as a backup, the team staff should always bring their own as a backup in case they're not available from the facility.
Yeah, I like John's answer too, and I think it's similar. You can think about wearing a seatbelt. Why wouldn't you wear your seatbelt? So I think people should be encouraged to bring their own masks, but I think you as an event operator, if you have the ability and able to find them, why not help provide them if need be? Do you need to buy 3,000 masks for everybody at your tournament? That's a different question, but I think to have some extra on site in case some of those situations, like a potential, we're worried that this person might have COVID situation arises, that you can provide that person with isolation and a mask. So I think that having some extra around, it's never going to hurt you.
Great. Let's keep going here. I'm going to try to get all of these questions. It's 12:06 right now. We've been going for 66 minutes. So I'm going to kind of stop this around 75 minutes. And any questions that we don't get to, because they're coming in fast and furious, email them out to people after the fact. So this one, this is obviously, I think, to John. As a sports club operator, do I need the waiver signed on behalf of the player and the parent? I assume they're talking about the COVID-19 waiver.
It's definitely best if the parent, and believe it or not, the minor player, in my opinion, should sign as well, because if in the majority of states out there, I think 41 states, the parental signatures will not result in dismissal of the lawsuit by summary judgment. So the major reason in 41 states is to give a risk warning to the minor. And the signature is helpful, but if you don't get the minor signature, there's a way to draft the waiver release, which we have done, where the parent states that they have explained the risk of participation to the child, and they understand it. So it's actually best if the minor does sign, as ridiculous as that may sound. But if not, if it's drafted properly, the parental signature can serve as the risk warning to the child. I think the majority of states say that a child, maybe ages 7, 8, or over, can understand risk for purposes of an assumption of risk defense.
Yep. Great. So a couple questions here. I'm going to put these together. The question is there a way for to be paired with a lead athletic trainer that is more capable, qualified of developing a response plan and being a coordinator? And then also they're asking whether Go for Ellis has COVID-19 coordinators. And I think the big answer here is that athletic trainers can do all of this. And so we have a lot of operators that work with us that hire lead athletic trainers to work with all the rest of the athletic trainers at these events. So I sort of answered both these questions at the same time. We see a lot of event operators, camp operators, clinics, club teams. They have someone who is in charge of all the other athletic trainers that can certainly help be a COVID-19 coordinator. I can tell you from my experience at Next Sports that the single most impactful thing we did as a company was to hire a director of health and participant safety. And all these things that John is referencing as it relates to liability insurance, if you're going to publish process and procedure and guidelines and policies, you need to find them and to follow them. And in the COVID-19 world, it's a little more complicated. So the answer to both of those questions is yes and yes, in terms of having a lead athletic trainer who can certainly also be a COVID-19 coordinator. Ellis, this is one for you. If athletic trainers are there to monitor, how many do you recommend on having? And I think this is obviously in response to the monitoring slide. You know, do you have 3 for every 2 fields? I know this is somewhat of a complex question because it depends on lots of other variables, but some sort of general answer would be helpful.
Yeah, depends is the answer for sure. But it really depends on your sport and your exposure and what are the rules. So did you eliminate some of it? So typically when we look at athletic trainers, we look at injury rates and what's the injury rate within the sport and the exposure to risk. How, if we're working a football game, it's going to be a lot different than working a little kid lacrosse camp where there's no contact and it's all stick skills. So it's a very much depends kind of answer. Typically, I lived in the lacrosse world very much. So there are some recommendations that are given out by the NGBs as well. That was again based on prior to COVID-19. So if there's recommendations from US Lacrosse, they recommend 1 athletic trainer to every 3 fields in play for their sanctioned event. That's a pretty good ratio. Typically at Next we would do 1 to 2. However, if there is a COVID situation that needs to be handled and they're going to have to be isolated, you might want to consider overstaffing. You should have some extra hands on deck because if one athletic trainer gets taken out for an hour and a half because they're doing an evaluation with a COVID parent or patient, they might be completely preoccupied and have to monitor that patient entirely. And you also have to think about the other things are still going on. So if somebody suffers another major injury and there's another ambulance, now you have 2 people that are preoccupied with 2 patients only, and you might be a little spread thin. So you want to make sure that you're looking at the sport-specific risks of what you're doing, tournament versus camp, football versus tennis. There's a lot of different ways to look at that and make that recommendation, but you can kind of look to your NGBs. They make a good, decent amount of recommendations about athletic trainers, but I would probably advise in the situation, especially because it's early on and everybody's figuring this out, more medical staff is not going to be a bad thing.
Great. Here's one for John. What are the thoughts of having officials sign COVID-19 risk assumption waivers?
I think it's a great idea. I think any staff member, whether it's team staff or league-wide staff, should sign an adult waiver release with that addresses the COVID situation. They're the ones that are at the highest risk.
Great. Couple other things, and then we can kind of wrap this up. Are there, Alice, I think it's you, are there concerns with recommending youth participants to wear PPE during play during summer months?
That's a good question. The CDC has made some recommendations as per masks and how you should wear them. Again, depending on the sport, it may not be comfortable, or people may not be able to wear a mask if they potentially have anxiety due to claustrophobia, or if the sport is just, there's too much equipment, or it's going to affect their helmet fitting. So there's, it's a very sport specific question. Younger kids might not be able to keep a mask on the whole time. So it's another, depends question or answer, but you need to look at the sport itself. One that you definitely don't want to wear a mask that they say that they've been very clear about is swimming. So do not put a mask on your child in the pool. I don't think I need to say that, but I need to say that. So it definitely depends on your sport and what you're doing. And if the participants are able to be comfortable having a mask, they might have some disabilities or other things where they can't necessarily wear a mask. So you want to make sure that you are working with your patient, really looking what your patient, what your sport specific risks are before you actually put the mask on or require a mask of that sport. Same thing with distancing. If there's a cross country meet and everybody's very far away from each other, it might not be very important to wear a mask. So the CDC is not recommending necessarily that you put on a mask to go for a run outside. So it kind of depends on what the sport specific risks are, and really taking a look at it. And that's another good resource that I know we're talking about, John's resource blog, that they have the CDC does have specific mask recommendations.
Great. Last two questions, then we're running out of time. John, this one's for you. E-waivers, DocuSign, really reduced touch points. Are there any concerns about them in terms of liability as it relates to parents signing remotely on behalf of youth?
Yeah, we have a blog on that too. Electronic waiver releases are very strong. In some cases, with the authentication you have digitally, they're even more certain or stronger than a paper waiver release. It's not a problem. Sometimes when if you have to sign on behalf, if the minor needs to sign but they're not there when the adult is registering, that can be a problem. But also it depends on how you draft it, if you can get around that or not. But no, electronic waiver releases are, if done properly, are legally strong.
Great. Actually, I can probably try to fit two more in here. Here's a big one. If you find out a person who participated in your event later tested positive for COVID-19, do you have an obligation to notify all attendees of the exposure? I think that's probably one for John.
I think that you probably do. I know the guidelines, the sample guidelines we've drafted do address that issue, and I'm pretty darn sure you should do it. But there's a way to do it in compliance with all federal, state, local laws, ADA, and everything. So you probably need to check some sources out, CDC or online, about how you proceed with that, because you don't want to mess it up. You need to do it, but you need to do it where you don't get in legal trouble.
Yep, and again, being very mindful of HIPAA. So not advertising that if you played against the Patriot team or whoever the team was, that there was somebody on their team that was sick. And so you need to make sure that you're doing that in a responsible way, so you're not violating the patient's rights as well.
Alice, and if you can just, so we had a couple questions regarding a tournament director in the same light here contacts the AT. days after the conclusion of the event, stating that there was a COVID-19 positive kid at the tournament. Does the AT have responsibility here, and what is it? So I guess the question is, what would you do?
Well, it depends if the person was seen by me. If it's a patient that I or one of the other athletic trainers saw, they need to be notified that they were in contact with a potential patient that now actually has a positive COVID-19 case. Got it.
Okay, great. I'm going to end with this last question, and there's still a lot of questions here that we will get back to people in the follow-up within 24 hours. We're going to kind of put this all together and try to write out answers for everybody. There's so many good questions. The question is could extra ATs help monitor social distancing signage, hand sanitizer stations, so that I can focus on running my event? And the simple answer to that is yes. Athletic trainers, whether you're going through Go for Ellis or you have a connection elsewhere, I can tell you as a longtime event operator and youth sports organizer that is the primary reason on why athletic trainers are so important here and so helpful, is that their skill set covers all of this. And we could do a whole nother webinar from Ellis on athletic trainers and what they can actually do. And I'm telling you that the extra ATs can handle all of this. At this point, I just want to go back here to sort of wrap this up. Is say thank you. We've had a lot of attendees. I want to thank Ellis and John. I really, at Go for Ellis, we feel very strongly that, the youth sports world right now is sort of paralyzed. It's paralyzed economically, it's paralyzed tactically, and everyone has a lot of information on how to deal with customers and parents and things like that. And we find, or the three of us in particular, feel very strongly that we need to move this forward. And so we hope that this webinar has given you some strategies on how to think about, and the considerations on how to think about, okay, how do I run a camp, right? When it becomes appropriate from a state and local level, how do I get started again? And I will tell you from a business owner standpoint in youth sports that consumer confidence that you have a plan is going to be really, really important. And so I appreciate both Ellis and John and all of their time. This webinar was presented by Sadler Sports and Recreation Insurance. I strongly suggest that you check out John and SadlerSports.com's website and blog. We can't cover everything that he has put into his blog post regarding return to play. So I can't stress it enough. And then obviously, athletic trainers are the front lines, in my opinion, as youth sports come back in online. And so currently Go for Ellis has over 11,000 athletic trainers on their platform in all 50 states. And I believe that we will be a great resource for all event operators to be able to help come back online. So once again, thank you, John. Thank you, Ellis. I hope everybody has a great day. And please look forward to our next webinar, which will be primarily tackling, okay, I want to run a camp. How would I do it? So again, thank you, everybody, and I hope you have a great day.
Thank you.
Thank you.